Welcome back to more TYT's The Conversation. Evidently, professionals were busy writing books during this pandemic, as we have another author for you. This time, it's epidemiologist and public health expert, Dr. Abdul El-Sayed. He's the co-author of Medicare for All, A Citizen's Guide. Welcome in, doctor.
Thank you so much for having me, Adrienne.
Yes, so healthcare, it's a hot button issue for most Americans. And they're getting information from all angles. So what does Medicare for All, A Citizen's Guide offer readers?
Well, we know that this pandemic has demonstrated just how broken our healthcare system is to deal with the worst pandemic in over a century. And we ask ourselves why. It's because ultimately every part of the healthcare system in America is run as a business. Everybody is trying to profiteer off of it. And what happens when you have a moment like this one? Is that people lost their jobs as the pandemic hit. They lost their health insurance. Hospitals had to cancel elective procedures, couldn't provide very basic things like PPE for their nurses and their doctors and their staff. And all of this has been part of the reason why we faced 450,000 deaths in this country and counting. We account for 20% of all deaths in this country. Medicare for All is a very simple approach. We basically say, take the profit motive out of health insurance. And we wanted to take this book out of the political arena and put it in the policy one. Talk about how Medicare for All maps to the challenges we face in our healthcare system. Talk about the history of this idea. It's a very, very long history, starts way back in the 1700s, and talk about the politics that it would take to get us there after we've had the discussion about what's wrong and how we fix it.
All right, well, let's talk a little bit about that in terms of unearthing the politics to get there. What do you think needs to be done?
Well, look, right now, we know that the majority of Americans, when they're asked about their support for Medicare for All, for single payer healthcare, for government healthcare, whatever you want to call it, they support it. The problem, though, is that you have an extremely powerful healthcare industry that has spent an absurd amount of money lobbying and electioneering and buying ads on the airwaves to change people's perspective on this thing. And they control a lot of the kinds of conversations that are had in places like Capitol Hill. And we believe that the only way that we continue to push for Medicare for All, the way that we will win Medicare for All, is to build the kind of coalition of people who believe in a healthcare system that is more just, equitable, and sustainable than the one we have. And that means continuing to do the work on the ground. And I know that a lot of folks are really frustrated about this moment in our politics. We have a Democratic president, yes, but a president who doesn't support Medicare for All. That doesn't mean that the battle is over. It means that we've made a lot of progress and we have to keep going. But it means doing the work on the ground to build coalition, to inspire doctors to be a part of it, to bring seniors along, to bring unions along. And if we can build the right coalition, we can continue to do the work, I believe that organizing will beat advertising every single day and that we will win the future for Medicare for All.
All right, so you say we need to get this ground level approach, we need to organize and uplift people. And I think that the American population has incentive to do it, but whether they fully appreciate that or not. But I guess in terms of maybe getting the institutions, getting capitalism on board, is there something there as well for them?
Well, I'll tell you, in the past, when we had the conversation about healthcare reform, it was always a conversation, in effect, about low-income people. And today, because of the greed of the healthcare corporations, because of the greed of the insurance industry, they've invented things like deductibles, which are $3,655 a year for the average family of four making $69,000. That's more than a paycheck, and folks can't afford it. So this is not a conversation only about how we provide healthcare for low-income people anymore. This is a conversation about how we provide sustainable healthcare for everyone, because all of us have skin in the game. And then the other point is this: it's not just healthcare corporations. When you look at the incentives of large businesses and small businesses around the country, we have to make sure that people understand that this makes economic sense. When GM, I live in Detroit, and when GM faced bankruptcy back during the Great Recession, they were paying 15 cents on the dollar of every dollar that they made selling cars to pay for retiree healthcare. The best way to take that off of their books is to pass Medicare for All. And if you're a small business owner, you know that providing healthcare for your employees is one of the hardest things you have to do every year. And so this makes sense for businesses large and small. The only people who are really against it tend to be the healthcare corporations. And we need to make sure that we are talking about the fact that their incentives don't align here, and that we have to be able to win the day for Medicare for All by talking about how it benefits people most of all, but also how it benefits small and large businesses in this country.
All right, so as a physician, specifically being an epidemiologist who studies diseases and whatnot, and also being a public policy expert, I would imagine that the last year has been incredibly frustrating for you as you've watched the pandemic unfold and the shenanigans and tomfoolery really come into play. So policy-wise, over the next 6 months, if you were able to mobilize people, what would you do?
Look, we have to keep having this conversation about Medicare for All. Right now, we are in the middle of a national crisis. And I used to be the health commissioner for the city of Detroit. I will support any effort to get healthcare out to folks right now. But we have to make sure that it's the right kind of healthcare. We have an opportunity right now, rather than giving money to the healthcare corporations that have failed us, the health insurance corporations that have failed the American public, we could be putting people who have lost their health insurance on to great public programs like Medicaid and Medicare. That's a choice we can make. We don't have to hand over good taxpayer money to the healthcare corporations that failed us in the first place. And so I really hope that we will get behind bills like those pushed by Representatives Pramila Jayapal and Senator Bernie Sanders around getting help in the form of high quality government healthcare to people, while recognizing that we have a responsibility to expand access to high quality public healthcare to everyone. And we can do both at the same time.
All right, so I have a question for you. In terms of, again, turning back a little bit to our capitalistic nature, there's something to be said about the fact that a lot of our healthcare is tethered to our employer. And thus it keeps, that ball and chain to keep us in a particular workplace. And we effectively end up maintaining a certain class of people or people at this class tiered system so that they feel indebted to their employer. And it's a pseudo slave system to a certain extent. So I guess my thoughts there are, how do you overcome that barrier that's very much built into our culture?
Yeah, well, a lot of the talking points that people use are they confuse the conversation about choice, right? Folks scare us. The health insurance companies scare us by telling us that any real reform will take away our choice and that we are indebted to our employer because they offer us a choice of 1 to 3 health insurance options. But that's not the choice we really want. The choice we really want is the choice to see whatever doctor we want. And the reality is that health insurance is the biggest gatekeeper to what doctor you can see. They tell us that it's going to cost us too much, that we can't afford it. And the fact of the matter is, if you look at premiums, you look at deductibles, which is the money you have to pay to get access to the healthcare you already paid for. You look at co-insurance and co-pays, the money you have to pay when you see a doctor, when you're on private health insurance. And it is costing us an excessive amount of money. And it's costing our employers a ton of money too. And so what we have to do is stand up and say, actually, we are the only country in the world that forces you to have employment, to have something as simple as basic, that is a right, as healthcare. And we have to decouple those because the system is failing. It failed us during this pandemic. It's been failing us for a really long time. Plus, even when you talk to folks in business, they'll tell you the most important thing we can do to unlock people's quote unquote human capital is to give them a choice to do the things that they want to do. And right now, people are stuck in dead end jobs because they're stuck with the health insurance that they have and they don't want to lose it for fear of hurting themselves or their families. And so imagine we didn't have that barrier to people being able to go off and start that new business or being able to go off and write that book. And I think it would not only obviously be good for those folks, but also it would be good for the business climate. And so, this notion that somehow investing in Medicare for all is anti-business is just not true. And it doesn't comport with the facts.
No, it doesn't at all. And unfortunately, that propaganda mill has really been beat into so many of us who do end up staying in these jobs that do not fulfill our purpose. And we are not engaged in our higher selves, but we stay because of those benefits. And that's very problematic, yet it continues to be the case. And so one other question I wanted to ask you, since among your many titles, you also happen to have taught as a professor or continue to teach as a professor at Columbia University in the Department of Epidemiology, and forgive me, I completely and totally mispronounced that because I am not as smart as you. But I was thinking in terms of what you'd want most people to understand and to know about Medicare for all. What is that one thing, if you could talk to every individual here in the United States, what would you tell them?
We have an opportunity to think and dignify our healthcare system as a human right rather than as a business. And right now, the corporate overlords who run health insurance companies, who run big hospital corporations and chains, they are making millions of dollars a year. Meanwhile, we're paying that out of our pockets to get access to a product in which we have very, very little choice, that robs our choice of the doctors that we want to see, and that makes us liable to bankruptcy to use the very thing we thought we had, right? The operative term in the word insurance is sure. And we can't really be sure of anything anymore because these deductibles and copays are so expensive. And if we lose our jobs, we lose it all. We have an opportunity to rethink that system, to guarantee every single person access to healthcare that does not go away, independent of what happens in their lives, that does not cost them an arm and a leg to use, and that allows them to see a doctor, whichever doctor that they want in any circumstance of their lives. We have a responsibility, a moral responsibility, to achieve that kind of healthcare justice. And if we were able to get past the fear mongering, to get past the talking points that they keep telling us that we're going to lose or it's going to cost us too much, that we can embrace a future where all of us can live free of the fear of what might happen if we get sick, and know that that's there for ourselves, our loved ones, our families, and our communities.
Thank you so much, Doctor. I appreciate it.
Thank you. I really appreciate you having me on.
Thanks for watching The Young Turks. Really appreciate it. Another way to show support is through YouTube memberships. You'll get to interact with us more. There's live chat emojis, badges. You've got emojis of me, Anna, John, JR. So those are super fun. But you also get playback of our exclusive member-only shows and specials right after they air. So all of that, all you gotta do is click that join button right underneath the video. Thank you.